Hi everyone, this is Dan and Kathy with Aaron's Hearing Center. Today we're going to show you some of the most common causes of hearing aid malfunction and what you can do at home to fix it. The most common complaint we get in our office is the old "my hearing aid isn't working." And we want to share with you things that you can do at home to fix the problem without coming to us if we can help it. The first thing to check is the battery. Sounds obvious, but it's the easiest thing to do. And the first thing that you want to do is replace the battery with a known fresh battery. If you don't have a good battery that you know is good, a good thing to do would be to switch the batteries between the hearing aids. If you have one hearing aid that's working and one that is not, change the batteries between them. If that changes the problem from one hearing aid to another, you know that it's probably the battery. It's also important to note that the battery should be new in the package and still have the tab on it before you use it. If the tab has been removed from the battery before its intended use, it will begin to drain regardless of whether it is in a hearing aid or not. So that's something important to pay attention to. For those of you that keep your batteries loose and maybe take the tab off of the battery and leave them in a purse or in a little container, it will drain the batteries. If you're sure that it's not the battery that's causing the problem, the next thing to check would be the no wax or wax stop. It's the little white piece at the end of the receiver. You'll see it at the end of an in-the-ear hearing aid, at the end of a receiver in the ear hearing aid. It's that little white piece there. We have a video on how to replace that piece. You can check that out for specific instructions on that. That little piece collects wax and prevents it from getting into the receiver and requiring repairs. Okay, so if you have a receiver in the hearing aid, if you have a receiver in the ear hearing aid and use a silicone dome, it is possible that the openings on the dome itself can become clogged, giving the same perception that the hearing aid has stopped working. There you see it's a little, in this case it's a gray dome. There is an opening on the end, and that opening can be clogged with wax or other debris, and you might think that the hearing aid's not working, or it might not be working as well. It's something to check out. If you clean that off in the morning by brushing it, you can prevent that from happening. You can clean it off with a tissue, or you can replace them altogether. They're generally sold in our office, and we recommend that they get changed periodically as they do degrade over time. Some other things to check on different styles of hearing aids would be on a BTE style hearing aid that uses an ear mold with a tube. Check the ear mold and the tubing to see if there are any obstructions. So if you look at the end of the tubing, you can see, clean that out a little bit. That tubing can also get fluid in it. In that case, you can, if you want, at home, you can blow out the tube if you have what's called a ear mold tubing blower. Most people don't have that. We can do it here in our office, but generally if your ear mold has fluid in it, if the tubing has fluid in it, you want to get that cleaned out and replaced, and we can do that in our office. Some other things that can happen with in-the-ear hearing aids especially is they're susceptible to problems with the microphones becoming clogged. Now, to clean them at home, you see at the top, or usually it could be at the top or on the sides, they can get debris in them. You can brush them off every morning to prevent problems, but you want to be careful, because if you stick anything in there, you can cause a problem with the microphones and damage it. We can help you in our office by cleaning it with a small vacuum that we use, or using extra care to clean it here. There you have it. We hope this video has helped you prevent the unneeded trip to the hearing health professional and helps keep you on the road to better hearing with as few bumps as possible.